Good morning, everyone. I'm Kendrick Heinlein with the Area Agency on Aging of Western Michigan, and joining me today are our local ombudsmen, who are employees of the Area Agency on Aging of Western Michigan. I have Kaye Scholle and Tammy Lynch, and we're hoping to answer some questions about what can be done during this time with COVID-19 in long-term care skilled facilities, in hopes of answering those for you and your loved ones. In efforts to reduce the spread of COVID-19 in nursing homes, the federal government has imposed certain restrictions on visitors and long-term care ombudsmen. How do residents and families continue to access their local long-term care ombudsman?
Given the fact that recently, due to the restrictions of visitors, unfortunately, the long-term care ombudsmen also are considered visitors in the sense. So we have been restricted to going into facilities. That being said, does not mean that we are not still available and very much involved in what is going on in each of the homes. One way to contact us is through our local phone number, which is 616-245-9451. Additionally, we have a statewide website that can be brought up to identify some other information that would be maybe of interest to you. And that would be mltcop@meji.org. So that's the Michigan Long-Term Care Ombudsman Program at MichiganElderJusticeInitiative.org. The website for the state long-term care ombudsman, which is the Michigan Long-Term Care Program itself, is mltcop.org. And that is a website that also has a lot of good information. One other ways that we have ensured that our contact information and our advocacy efforts continue is flyers were sent to all licensed skilled nursing facilities in our state that identified the local long-term care ombudsman that covers that particular facility with their direct contact information and a picture. We are hoping that this will encourage individuals to know that we are still very much available for them to discuss any issues that they are having, any suggestions that they might have as far as how their particular facility can also help support them in this time.
Thank you, Kaye. Tammy, what are some ways residents and families can stay connected during this time?
Current restrictions being imposed on in-person visitation, it's really important that residents have access to family and friends and loved ones. Some ways that they can do that would be through regular phone calls, as well as sharing of cards and letters. Video conferencing is another great way to keep in contact with your loved ones through platforms such as FaceTime, Skype, Zoom, and many facilities have access to cell phones, tablets, iPads, such to help accommodate that, and they should be available to assist residents with that. Another way would be through regular emails and text messages for those that have access to those things. A great resource for residents and families to look at for other ideas as well would be the Consumer Voice has a really great website and fact sheet that has some great ideas on keeping people connected during this time, and families and residents can go to theconsumervoice.org and use the hashtag love from a distance to get all kinds of ideas to help support residents and families in their efforts to maintain contact with each other during this time.
Thank you, Tammy. Kaye, what can residents and families do if they have concerns about a facility's infection controls practices or other issues?
Most important thing is obviously to state them to an individual within the facility. The first suggestion that I have is to contact the director of nursing or the administrator about these concerns. Given that normally they would probably like to have a grievance form filled out that is within the facility, that's not going to happen during this time, but I would contact them directly via the facility itself. You are also always welcome to contact the Long-Term Care Ombudsman Program, which is Tammy or I, to facilitate and advocate to a resolution. While we are, again, not in the facilities, we still have very good contacts and very good relationships with our facility staff where we can call and hopefully facilitate something reasonable, or at least to gather understanding of what is happening. Another opportunity to express concerns or complaints is to contact Licensing and Regulatory Affairs Agency at 800-882-6006. This agency will go in and investigate concerns and allegations regarding resident care and so on. Currently, the agency is really focusing on many of their efforts on the infection control, which is understandable, but please know that your concern will be taken in and will be addressed as soon as time allows.
Tammy, what are some things that can be done to promote safe care and keep residents' morale up during this time?
Well, some things that residents and families can do is request specifically from their facilities that they provide regular updates pertaining to what they're doing to prevent the spread of COVID-19 in their facilities, as well as how they are caring for residents, any residents who may be ill. Many nursing homes are providing regular updates on their websites. Another thing that families can do is request that administrators share the results of the facility's self-assessment of its infection control practices. Requesting that regular times be scheduled for residents to communicate with their families and loved ones and to be able to assist those residents if needed in doing so. Activity staff can use a lot of different creative ways to continue regular activities with residents, even with residents being there in their room on an individual level to support residents being able to continue to have that stimulation and to be involved in activities and things that they enjoy and help against some of the effects of the isolative nature of this current situation. Other things that some buildings are doing is that with residents' permission, utilizing Facebook to share photos, messages, stories with each other and with family and friends, just to kind of keep morale up, to keep that connectivity in place, and to give residents that sense of not being alone, still being able to connect with their loved ones, albeit in a different form at this time.
Kaye, what are some good mental health practices for residents and their families during this time?
The most important thing, again, is a communication with staff members, and that coming from the residents. It's entirely expected, I guess, if you will, for all of us to be impacted in this environment by feeling sad, being blue, feeling isolated, feeling a lot of, I guess, negative feelings that just kind of make us feel hopeless and maybe helpless. The most important thing is that we need to communicate those and not to keep them internal. Contact the social worker at the facility if you are a resident. They're trained to be able to identify and help you, give you some mechanisms or tools that are going to help you at least process those feelings. But most important, validate it. I mean, you have the right to feel that way, and you certainly is understandable that you are. As far as for family members, I would say many of the same thing, or family or friends of those that are in the skilled nursing home, and you're missing them. That's another very valid situation, and you're also scared for them because you don't know what is going on, and perhaps you are their best advocate prior to the COVID-19 coming on board with us. The most important thing there is to reach out then to your families and perhaps even suggest if you could get some communication going with other family members that have individuals in skilled nursing facilities or assisted living facilities, and at least talk through and maybe generate some ideas of how you can still keep in touch, which Tammy mentioned earlier. Gave you some great ideas, but also just, I guess, discuss amongst yourself how hard this is to be away from somebody you love so much and feeling isolated. You know, we all will get through this, but we all need to be together in this.
Thank you both so much for joining me today. As always, if you have any questions, please don't hesitate to reach out to our local state ombudsman office. We'd be happy to respond and answer any questions that you have. So thank you.